Hello to everybody. I am Luca Busetto, a member and co-chairman of the Obesity Management Task Force of the EASO. And I am here today for introducing to you the winner of the New Investigator EASO Award for Clinical Research. We receive a lot of interesting applications this year, despite the epidemic and the virtual Congress. And I am very pleased to inform you that the winner for this year of the Clinical Research New Investigator Award for EASO is Giovanna Muscogiuri from Italy. Giovanna she's my close friend, so I am very happy to have the possibility to introduce Giovanna for this important award. Giovanna Muscogiuri worked as assistant professor at the University of Naples Federico II, and she is a staff member of the UNESCO Chair Federico II University. Giovanna graduated in medicine at the Catholic University in Rome, and then obtained a specialization in endocrinology and metabolic disease, and a post-degree in endocrine and endocrine surgical experimental science in the same university. She spent a few years abroad working in an important center for metabolic diseases research at the University of Texas in San Antonio. And now she is working in Naples under the guidance of Professor Maria Colau, and she is very active in research and clinics. She worked in many projects during this year, is an important member of the Italian Obesity Society, as she is recently appointed in the National Board of Directors of the Society. Is also a EASO National Clinical Fellow, as she is involved in the recent production of important guidelines. The focus of Giovanna in the recent year is the link in between chronotype and sleep and nutritional pattern. And the focus of the presentation of Giovanna today will be in this recent research. So Giovanna, please, I leave the floor to you for your presentation, and I will be happy to discuss your presentation a bit after your speech. Thank you, and the floor is yours.
Thank you, Professor Busetto, for the presentation. I thank the scientific committee for giving me this award. My research field are chronotype, that is the attitude of subjects in determining individual circadian preference in behavioral and biological rhythm relative to the external light-dark circle, and the sleep quality, that is defined as one's satisfaction of the sleep experience, integrating aspects of sleep initiation, sleep maintenance, sleep quantity, and refreshment upon awakening. All these research fields were studied in the context of obesity. In particular, I did this study in which I investigated the association of chronotype categories with the adherence to the Mediterranean diet in a population of middle-aged Italian audience. This was a cross-sectional study that was carried out during a campaign to prevent obesity that was called the Opera Prevention Project, and was held in Naples on 11-13 October 2019. We enrolled 172 subjects, and as you can see, subjects with the nadir type were younger than the morning type and then evening type. But subjects with the evening type were more frequently a smoker than the other two categories, and were more frequently sedentary compared to morning type and nadir type. As you can see here, subjects with the evening type had the lowest adherence to the Mediterranean diet, and chronotype score positively correlated with age, but negatively correlated with BMI. After this, we wanted to investigate the association of chronotype categories with each item of the Mediterranean diet, and we found that the most powerful predictive factor of morning and evening chronotypes was the cluster of foods belonging to the Mediterranean diet instead of a single food. And of course, morning chronotype had a higher adherence to the Mediterranean diet, and conversely, evening chronotype a lower adherence. But we found that the intermediate chronotype was associated with the intake of butter, cream, margarine at least once a day, thus suggesting that saturated fats could have a role in determining this chronotype. In the very same population, we identified a Predimed score higher than 8 as a threshold to identify subjects with the morning chronotype. We also investigated the association between chronotype categories and cardiometabolic health in obesity, and we found that evening chronotype was associated with type 2 diabetes and cardiovascular disease compared to morning chronotype and intermediate chronotype. Another research field is the assessment of sleep quality in obesity and this association with nutrition. So we carried out this study in patients that were in our outpatient clinic. That were enrolled in our outpatient clinic, and we found that, as well known, poor sleepers had a higher BMI compared to good sleepers, and had a higher number of subjects with obesity compared to good sleepers, and higher waist circumference values compared to good sleepers. But also we found that poor sleepers had a lower adherence to Mediterranean diet compared to good sleepers. We found that PSQE, that is a PIT score, that is Pittsburgh Index score, was positive correlated with BMI and with circumference, and was negatively correlated with the Predimed score, that is a tool to measure the adherence to Mediterranean diet. In this study, we identified the cutoff of Predimed score lower than 9. That was associated with poor sleep, thus suggesting that the sleep quality should be assessed when Predimed score is lower than 9, because there is a high possibility of detecting sleep disturbances. And also we carried out this interesting study that was performed in subjects during COVID-19 quarantine, and we enrolled 121 adults, aiming to investigate the change of anthropometric parameters and sleep quality after 20 days of quarantine lockdown. So we found that after quarantine, our patients significantly increased the BMI values, and this occurred for both males and females. And there was also an increase of the prevalence of overweight, grade 1 obesity and grade 2 obesity. And it is interesting that we found that the worsening of sleep quality occurred as well as BMI worsened. After this, I also published several papers that investigated the association between obesity and sleep, aiming to provide also nutritional strategies to manage this sleep disturbance in obesity settings. At the end of this story, I would like to thank my mentors, in particular Professor Ralph DeFronzo of University of Texas Health Science Center, and Professor David Matthews from the University of Oxford, Angelica Bierhaus of University of Heidelberg. But also I would like to thank Professor Colau and my research team in Naples University, Professor Savastano, and all my colleagues in Naples. And finally, I would like to thank my family that accompanied me in this journey that is called life. Thank you.
Thank you, Giovanna, for this very, very brief but intense presentation. Very, very nice results and very huge block of studies and work. I have a few questions about, first of all, about your definition of the chronotype pattern. So do you use the morning chronotype as compared to the evening chronotype? How you define the two chronotypes? It's a matter of the amount of calories in the morning or in the evening, or is more about the number of food contacts? How what method do you use for distinguish in between the two chronotypes?
Okay, the subjects underwent to morning-evening questionnaire. That is a questionnaire in which there are several items that ask to the patient when they used to perform their daily activities. So it means when they go to bed or when they used to eat, and after this, at the end of this questionnaire, there is a score. And based on this score, we can define three categories. That is morning chronotype, the third subjects that prefer to perform their daily activities during the morning, and evening chronotype, the third subjects that prefer to perform their activities during the night, and the intermediate chronotype, the third subjects that prefer to perform their activities half in the morning and half, we can say, in the evening.
And I was also impressed by the relationship and the speed of weight gain during the lockdown. So it's really impressive, because in the mean you have an increase in 1 point of BMI during only 20 days. So it's this weight gain did happen in the majority of the patients, or of you observe a variability. So there are more weight gainer, or people that gain more and people that gain less.
Okay, we did not find a significant difference among in the group, but it was very interesting that subjects that did smart working increased more BMI and worsen sleep quality. And this is because maybe there was an increased stress that also was due to the stressful news from media, and the subjects were more prone to increase their food intake, but at the same time they did not go out or do physical activity, and so this mix lead to the increase of weight gain.
And this was also associated with the poor sleep quality, is right?
Yes, yes. Because the worsening of sleep quality positively correlated with the weight gain.
So it's like a matter of stress
Yes.
in general. We can suggest that it's
yes.
more stress, poor sleep quality, more weight gain, and so on.
Yes.
Okay, thank you. It's a very interesting field. I think that we need more research on this field. Do you think that this difference in morning or evening pattern could influence also our clinical approach? So we need to use different type of diet or something else in order according to the nutritional pattern, or not, or is indifferent?
Yes, I believe that this could represent like a kind of revolution in the management of obesity, because we used to prescribe drugs or suggest physical activity or suggest a decrease of calorie intake. But many doctors do not ask information about sleep quality and chronotype, and we demonstrated that chronotype and sleep disturbance could increase the risk of developing metabolic disease. So we can say that if we have two subjects with the same BMI, we can find that subjects that has evening chronotype has an increased risk to develop metabolic disease and cardiovascular disease. So I believe that the management of obesity should also include the assessment of chronotype and sleep quality, and to suggest to how modify this wrong behavior. Because I believe that if evening chronotype try to switch to morning chronotype, they could have some benefit in the meaning that they can reduce the risk of developing metabolic disease. So a nutritional pattern should be tailored also on chronotype features.
Okay. Very good. Thank you. Thank you. It's a very interesting new field in research. So I think that we discussed your presentation. We have a few minutes, and so I know that a part of this important work, you recently also published an important guidelines on the use of the very low calorie ketogenic diet, a guideline endorsed by the EASO. Can you summarize in a few words the content of your guidelines? Very few words.
Yes.
Just for making some advertisement to
Okay. So I was very delighted to be the project leader of the EASO guidelines on well-CKD and in the management of obesity. And I believe that this is a very promising nutritional approach because we review several studies on this topic. And we conclude that is a very effective nutritional approach in the way that preserve lean mass and encourage the loss, the fat mass loss, but at the same time is a nutritional approach with very few side effects that are easy to be managed.
Thank you, Giovanna. I strongly agree with you, and I encourage of the people here to have a look to the paper, because I think that you and your co-worker Marwan and Yaruch, you really did a very good job. So
thank you.
My congratulations again for your award here. I hope that this award will represent for you a continuation of your brilliant career, and I personally hope that we will have more and more occasion to work together in the Italian Obesity Society and here in the European Association for the Study of Obesity. Thank you again for presenting your candidacy for this award and for winning.
Thank you.
Good luck for the future.
Thank you.
And that's a wrap. Thank you. That's perfect.